There is an unspoken truth in medicine that almost no doctor discusses with their older patients. Picture this. You are over 60. You take care of yourself. You drink your water, stay active, and follow your prescriptions to the letter. Then you wake up. Your tongue feels glued to the roof of your mouth. Your lips are cracked, perhaps even bleeding at the corners. You reach instinctively for a glass of water just to be able to speak. If that sounds familiar, this is not simply a sign of getting older. It is your body's first loud warning signal, a physiological red alert that something beneath the surface is fundamentally out of balance. As a specialist, I see this pattern every single day. Patients dismiss morning xerostomia, the clinical term for dry mouth, as a minor inconvenience. They ignore the sandpaper sensation in their throat and the burning on their tongue. And most fatally, they miss the window to catch silent, life-altering diseases before they cause permanent damage. Why? Because most people believe dry mouth is just about thirst. In reality, it is a breakdown of your body's most critical frontline defense system. In this video, I am going to give you the unvarnished medical reality of why waking up with a dry mouth after 60 is a clinical marker you cannot afford to ignore. I will show you the 5 powerful health benefits you unlock the moment you stop treating the symptom and start addressing the cause. And I promise you, we are building toward one single surgical protocol. One precise evening routine identified in clinical studies as the gold standard for restoring salivary flow and protecting your systemic health while you sleep. To understand why we need to change our strategy, we need to look at what actually happens in the body during sleep. Saliva is not just spit. It is a complex biological fluid that neutralizes acids, remineralizes teeth, and serves as an antimicrobial shield. Physiologically, salivary flow drops significantly while you sleep, but for over 30% of adults over 65, this natural drop turns into a pathological desert. Your mouth becomes an incubator for decay and inflammation. When you wake up parched, it is often because your body has been forced into mouth breathing to compensate for airway obstruction, or because your internal chemistry has been hijacked by polypharmacy. Researchers have found that this sensation isn't just about comfort. It is a predictor of your risk for malnutrition, tooth loss, and even aspiration pneumonia. So we need to look at the 5 specific benefits of taking this symptom seriously. Number 5. The iron shield for oral longevity. We begin with the structural integrity of your mouth. Many people over 60 suffer from sudden, aggressive cavities at the gum line or find that dentures no longer fit. This happens because you have lost your liquid armor. Without saliva to wash away plaque, your teeth sit in an acid bath for 8 hours every night. A study from the University of Southern California found a staggering correlation between the number of medications a patient takes and the destruction of their oral environment. If you take 3 medications, your risk of dry mouth jumps to over 60%. By addressing morning dryness, you aren't just getting rid of a sticky feeling. You are preventing root caries and periodontal disease that lead to total tooth loss. Number 4. The nutritional safety net. This next benefit addresses a silent crisis, unintentional weight loss and malnutrition. Saliva is the first step in digestion. It contains enzymes that break down food and creates the bolus that allows you to swallow safely. When you wake up with a dry mouth, it is a sign that your salivary glands are struggling throughout the day as well. A review on geriatric dysphagia, swallowing difficulties, highlights that xerostomia is a primary driver of the lump in the throat sensation. Patients begin to subconsciously avoid hard, fibrous, or dry foods. They stop eating proteins that are difficult to chew. By restoring your salivary function, you stabilize your weight and protect your body from the frailty that comes with malnutrition. Number 3. The early warning system for silent killers. This is the most critical medical reality of all. Morning dry mouth is frequently the canary in the coal mine for 2 dangerous conditions: diabetes and obstructive sleep apnea. Clinical data from the Cleveland Clinic confirms that extreme morning thirst and dryness are often the first signs of undiagnosed type 2 diabetes. When blood glucose is chronically elevated, your kidneys flush excess sugar, leading to systemic dehydration and suppressed salivary flow. Furthermore, if you wake up parched, there is a high statistical probability that you have sleep-disordered breathing. Studies show that while only 3% of healthy sleepers report morning dry mouth, over 31% of those with severe sleep apnea suffer from it. The dryness is caused by the narrowing of your airway, forcing your mouth open to gasp for air. Taking this minor symptom to your doctor could be the reason you catch a cardiovascular risk factor before it turns into a stroke. Number 2. the aspiration defense. As we age, the risk of respiratory infections becomes a major concern. There is a direct link between the health of your mouth and the health of your lungs. When your mouth is dry, the microbiome shifts. Harmful bacteria proliferate in the absence of saliva's antimicrobial proteins. If you have even minor swallowing issues, you may microaspirate these bacteria into your lungs while you sleep. Research in care-dependent older adults has shown that poor oral status and inadequate saliva are significant contributors to aspiration pneumonia. By managing your xerostomia, you are lowering the bacterial load in your oral cavity. You are essentially cleaning the air that enters your lungs. Number 1. The quality of life restoration. We are now coming to the benefit that impacts every single hour of your day. Studies using the OHIP14 scale found that seniors with chronic dry mouth score 28% worse across every category, from physical pain to psychological discomfort. Dry mouth causes sleep fragmentation. You wake up multiple times a night because your brain is signaling a drought. This leads to daytime fatigue, irritability, and social withdrawal because you are embarrassed by bad breath or the way your speech clicks. When you fix the morning dryness, you fix the sleep. When you fix the sleep, you restore your cognitive energy and your desire to engage with the world. You might be frustrated right now, thinking this is just another thing to worry about, but frustration without action is a wasted emotion. Acknowledging the problem is the first step toward the protocol. We are now going to implement the surgical protocol for nocturnal oral protection. This is the gold standard for anyone over 60 who wants to wake up with a functional, healthy mouth. Step 1. The medication audit. Gather every prescription and over-the-counter pill you take. Look for antidepressants, beta blockers, or diuretics. These are xerogenic bombs. Do not stop taking them, but ask your physician, is there a non-xerogenic alternative, or can we adjust the timing so the peak effect doesn't hit while I am sleeping? Step 2. The airway check. If you snore or wake up gasping, the dry mouth is a mechanical issue. If you use a CPAP and still wake up dry, you likely have a mask leak. Ensure you are using heated humidification and consider a chin strap to prevent mouth leak. Step 3. The hydration timing. Drinking a gallon of water right before bed leads to frequent bathroom trips, further dehydrating you. Instead, ensure steady hydration throughout the day. Your final medical sip should be a small glass of water 30 minutes before bed, followed by a xylitol-based saliva substitute gel. This creates a synthetic shield that lasts longer than water. Step 4. The stimulus. If your doctor confirms your salivary glands are functional, use sugar-free lozenges containing xylitol in the early evening. This exercises the glands and ensures they are primed before the nighttime drop. Dry mouth is not a sentence you have to serve just because you have reached a certain age. It is a clinical signal that requires a tactical response. Use the medication audit to diffuse the chemical triggers. Use the airway check to stop the evaporation of your defenses. And use the hydration timing to protect your teeth and lungs while you rest. Your body remains remarkably adaptable, but it cannot defend itself without the liquid gold that is your saliva. Start this protocol tonight, take control of your oral and systemic health, and wake up refreshed.